Gazebo Natural Healthcare in Toronto. We're on St. Clair at 804 St. Clair Avenue West. I'm a registered acupuncturist and traditional Chinese medicine practitioner, and I'm here today to talk to you about how to strengthen your elbow if you have elbow pain. If I had a hammer, I could show you these exercises. You know what? Let me put the hammer down for a second, because actually I want to talk to you about what I just said about the title of the video. Now, strengthening your forearm or elbow for elbow pain isn't exactly the approach that an acupuncturist will necessarily use. Now, if you're having elbow pain, first of all, you should seek a qualified acupuncturist or a physiotherapist, a chiropractor, perhaps an osteopath. We have all of those services at Yellow Gazebo, so please check them out as well as come in to see me potentially. What my approach as an acupuncturist is to look at any type of pain as blockage. So strengthening a muscle might be kind of a byproduct of an exercise that I'll give, but for me it's actually about unblocking things and getting things moving again. So stretching may be involved, strengthening may be involved, but that's not how I pursue it, and I try to encourage people to do the same. Don't think of pain as something that you have to strengthen to get rid of or stretch to get rid of, but something that you have to release. Okay? We can talk more about this in person if you'd like. Now, there are two types of elbow pain. There's medial epicondylitis, which is the inside elbow here, also called golfer's elbow, and there's lateral epicondylitis, which involves the bony part of the humerus on the outside of the arm, which is often called tennis elbow. Now, so a lot of people, if you Google these sorts of exercises on the internet, you'll find that people will give you exercises to stretch like this, stretch like this. I have some wrist stretching exercises in another video I'll put a link to in the info section for this video. What you can do is do those wrist exercises, but with any stretching or strengthening exercise that you're doing, please stop if there's any pain, because it's not working if there's any pain. Okay, let's say that first of all. Now, the way to stretch, so let's say you have lateral epicondylitis. Generally the stretch is to push lightly on the wrist here. I'm also going to include a link to AIS stretching, because I don't want you to hold a stretch for 30 seconds. I actually want you to hold it for 2 seconds and release. 2 seconds and release. By pressing like this, you can really kind of injure things going on in the wrist. Yes, you can strengthen your extensor muscles, play around with that, but what I recommend actually to really stretch or strengthen something, and it should be said, medial epicondylitis, golfer's elbow, you're gonna stretch like that. Anyway, I recommend using some acupressure points. Now, what you want to do is really simple to use acupressure. You take your thumb and you press on sore spots. So here's my elbow. Here's the bone on the outside that hurts. Maybe 3 finger breadths from that elbow towards the center of the hand. Press your thumb in there, you'll find it's tender. Even if you don't have elbow pain, press there, it's going to be tender. On this, again, it's about, so from the medial epicondyle to about the center of the hand, about 3 finger breadths. Press, it's going to be tender there too. These are really good points for treating elbow pain. Also, you want to look at a point, this is your acromion process in the shoulder. Point here at Sanjiao 15, if you're an acupuncturist. Press in there, it should be a little bit tender. For medial epicondylitis. For lateral epicondylitis, you want to actually find lung 1 or lung 2, which tend to be up around here, just under your clavicle. It's your pectoral muscle, basically the edge of your pectoral muscle. You want to keep that name tag straight. You want to do it on this shoulder. You'll find there that it's tender, and you want to kind of release that. So, great, much better ways than stretching, I think, is to get work there. And you can see registered massage therapists, for example, for that, or our physio, or me for acupuncture, or an osteopath, even the chiropractor can help you with this sort of thing. So, great exercise that you might be shown is one with my trusty hammer. Now, for actually either epicondylitis, this is the exercise. You want to keep the forearm steady. The hand is a bit loose. Now, The hammer has some weight to it, and depending on how much strength you may need to hold the hammer. If you're very, if you've just recovered, and what I mean is, don't do too much or any exercise until the inflammation has gone down quite a lot, because you don't want to cause more inflammation with exercise. Again, a good reason to see. Hi, well, sorry, I was just shooting a video there. Okay. You're not going to believe that. Someone actually stalked me wanting to know more about elbow exercises. That it was a total coincidence. All right, that's not true. It was something completely unrelated, but as you can tell, we're very busy here, and so I better just hurry up and get on with the exercises. So the one strengthening exercise, going on one side or the other, always brace that forearm. Another exercise that you'll find, if you go on the internet, some people with lateral epicondylitis, for exercise, they'll tell you to just do wrist extension. Okay, some people will tell you to do wrist flexion, always keeping the forearm flat. Same with medial epicondylitis, they'll show you exercises curling the wrist up. Now, generally, doing the shortening, the part where your muscle is doing the contracting, that's the faster part, and you should lower it down slowly, whatever part of your elbow you're doing. Again, if there's pain, avoid that. Other people will tell you too to do this exercise to help, especially with medial epicondylitis, up and then assist in lowering. Either way, whatever type of elbow pain you have, you should be seeking a professional for their guidance, because ultimately the work that they're going to do on helping relieve you of that pain is going to go a long way. So please give us a call, email us, we'll have the information in the section after, and